Good afternoon. I will discuss to you the Administrative Order number 2021-0037. This is the new rules and regulations governing the regulation of clinical laboratories in the Philippines. Rationale of the AO. By virtue of Republic Act No. 4688 Series of 1966, an act regulating the operation and maintenance of clinical laboratories and requiring the registration of the same with the Department of Health, providing penalty for the violation thereof, and for other purposes. The Department of Health, through the Bureau of Medical Services, now known as the Health Facilities and Services Regulatory Bureau, or the HFSRB, was mandated to ensure public health, safety, and welfare through enforcement of the Act, and was authorized to issue such rules and regulations as may be necessary to carry out the law. Clinical laboratory services play an important role in the diagnosis, treatment, prevention, and control of disease. Thus, it is imperative that the laboratories generate accurate, precise, and reliable laboratory test results in a timely manner to aid the physicians in assuring the quality of patient care. Through the years, several laboratory technological advancements have been introduced. As such, there are certain provisions in the current AO number 2007-0027 dated August 22, 2007, revised rules and regulations governing the licensure and regulation of clinical laboratories in the Philippines that may have become outdated. This policy is being issued to align the laboratory procedures with the requirements of AO 2020-0047, rules and regulations governing the licensure of primary care facilities in the Philippines. The necessity to review the current AO and to revise and update the minimum standards and technical requirements for licensing clinical laboratories in the Philippines is aligned with the main objective of Republic Act No. 11223 or the Universal Healthcare Act, which is to guarantee access to quality and affordable health products, devices, facilities, and services. Objective. These rules and regulations shall serve as the new guidelines in the licensing of diagnostic clinical laboratories in the Philippines, which shall ensure accountability of the laboratory on generation of accurate, precise, and reliable laboratory results in a timely manner through continuous compliance. Definition of terms. I will only highlight here the new terms indicated in this new AO. And these are the Mobile Clinical Laboratory. This is a laboratory testing unit capable of performing limited CL diagnostic procedures. It moves from one testing site to another, and it has a DOH licensed CL as its main laboratory. Physician's Office Laboratory refers to a doctor's office or clinic wherein clinical laboratory examinations are performed for the purpose of monitoring the doctor's patients only, wherein no official result shall be issued. In this order, POL within the premises of a DOH-regulated facility shall be under the supervision of the CL. Point of care testing refers to diagnostic testing done or near the site of patient care rather than in the CL. It may be in the emergency room, operating wards, and ambulances. Satellite Clinical Laboratory. This refers to an extension of the main CL located within the facility's compound or premises. It shall have the same service capability as the main laboratory. Referral test. This refers to CL tests that are either sent out or outsourced to other DOH licensed CL with the same or higher service capability. For the new general guidelines, all clinical laboratories shall secure DOH LTO prior to its operation and must comply with the minimum regulatory standards and requirements at all times. The DOH LTO shall be secured from the DOH Regulatory Office in accordance with the DOH guidelines. Only DOH licensed institution-based CL may have a SCL which shall be located within the premises of the regulated health facility. A DOH licensed CL may have MCL services as listed in Section 4 of Annex A, provided they adhere to the standard testing protocols. The DOH licensed CL shall not perform any examinations or testing beyond its authorized service capability. However, it may be allowed to offer laboratory services other than the respective stipulated minimum services, such as but not limited to MCL, SCL, confirmatory testing for glucose 6-phosphate dehydrogenase or G6PD deficiency, and rapid HIV diagnostic algorithm or the RIBDA, provided that the additional services have been approved and indicated as add-on services in the DOH LTO of the clinical laboratory. For a unit or section of health facilities performing diagnostic CL tests, such as but not limited to arterial blood gas and or radioimmunoassay for thyroid function tests and prostate-specific antigen shall be under the DOH licensed CL. The head of the CL shall be a pathologist certified by a professional organization recognized as the Accredited Professional Organizations or Accredited Integrated Professional Organizations of the Professional Regulation Commission. The head of laboratory shall ensure the optimal overall operations and maintenance of the CL and, if applicable, of its SCL and NCL. There shall be an adequate number of competent personnel assigned in the different services provided by the DOH licensed CL, which includes the MCL, SCL, remote collection activities if applicable. Clinical laboratories that are operated and maintained exclusively for research and teaching purposes shall be required to register with the DOH HFSRB. The DOH designated NRL shall be covered by the license of the CL of the hospital where they are affiliated with. Independent NRLs or those designated by DOH but are not affiliated with any DOH regulated health facility shall secure a DOH LTO from HFSRB. All CL shall make their prices for laboratory services accessible to the public as mandated by the UHC law and related DOH issuances. At the central office, the Director 4 or in his or her absence or unavailability or when delegated the Director 3 of HFSRB shall approve the issuance of the DOH LTO of the CL. At the CHD, the Director 4 shall approve the issuance of the DOH LTO of the CL. In the advent of new technologies or diagnostic platforms that shall affect the current licensing standards for CL, department circulars shall be issued as needed as supplements to this order. The CL shall be compliant with the prescribed standards and requirements under Annex A, Assessment Tool for Licensing Clinical Laboratories, Annex B1 and B2, and other relevant laws and issuances. This standard shall also apply to MCL and SCL. The DOH LTO may be revoked, suspended, or modified in full or in part for any false statement by the applicant, or as shown by the record of inspection, or for a violation of or failure to comply with any of the terms and conditions and provisions of these rules and regulations. Specific guidelines. Classification of clinical laboratories are classified according to ownership. For government, they are operated and maintained partially or wholly by the national government, a local government unit, provincial, city, or municipal, or any other political unit or any department, division, board, or agency thereof. For private, they are privately owned, established, and operated with funds through donation, principal investment, or other means by any individual, corporation, association, or organization. It is classified also by institutional character. For institution-based, this is a laboratory that is located within the premises and operates as part of a DOH licensed health facility. For non-institution-based, a laboratory that operates independently and is not attached to any DOH licensed health facility. According to classification by function. For clinical pathology, it deals with the chemical and cellular analysis of blood and other body fluids. This includes clinical chemistry, clinical microscopy, toxicology, therapeutic drug monitoring, immunology and serology, hematology and coagulation, identification and examination of microbes and parasites, that is bacteriology, parasitology, mycology, or virology. For anatomic pathology, it provides processing and examination of surgical specimens as to the physical appearance and microscopic structure of tissues, such as, but not limited to, surgical pathology, cytopathology, immunohistochemical techniques, autopsies, and forensic pathology. For molecular pathology, it deals with the analysis of certain genes, proteins, and other molecules in samples from organs, tissues, or bodily fluids in order to diagnose disease and or to guide the prevention and treatment of disease based on the principles, techniques, and tools of molecular biology as they are applied to diagnostic medicine in the laboratory. Classification by service capability. For clinical laboratory, for clinical and anatomic pathology. Laboratories are classified according to primary, secondary, tertiary, and limited, and there are also some sections here. For the primary category, it provides the following minimum service capabilities under the clinical microscopy, and are urinalysis, fecalysis, fecal occult blood test, pregnancy test, rapid test kits, lateral flow, wet smear for trichomonas. For clinical chemistry, fasting and random blood sugar, oral glucose tolerance test, lipid profile, total cholesterol, HDL, LDL, triglycerides, creatinine, blood urea nitrogen, and blood uric acid. For the secondary category, it provides the minimum service capabilities of a primary category plus the following examinations under the clinical chemistry: serum electrolytes, sodium, potassium, chloride, ALT, and AST. For the tertiary category, it provides the minimum service capabilities of a secondary category plus the following examinations under the clinical chemistry: other clinical chemistry examinations, and for hospital-based, it includes the arterial blood gases. For the limited category, it provides one or two specialized tests that are not classified under anatomic or molecular pathology as exemplified below: hormones, trace metals, tumor markers, allergy panel. These classifications shall also apply to facilities offering DOH program-related tests, example, the malaria smear, filarial smear, slit skin smear, and HIV testing. For the hematology section, the primary examinations are the CBC, hemoglobin hematocrit, red blood cell count, white blood cell count with differential count, quantitative platelet count, forward and reverse ABO grouping, and RHD typing, the tube method. For the secondary category, under the hematology, for hospital-based coagulation studies, the PT and the APTT. For serology and immunology, we have the dengue test, syphilis, hepatitis B screening, HIV screening using rapid test kits. For the microbiology, we have the TB-DSSM or the nucleic acid amplification test for government facilities. For the secondary, under the microbiology section, they can perform gram stain and the KOH. For anatomic pathology, they can perform pap smear. For the tertiary category, under the serology and immunology, any machine-based serological and immunological testing such as but not limited to tumor markers, thyroid function tests, and hepatitis profile. For microbiology, culture and sensitivity, that is aerobic and anaerobic, and for hospital-based cytology and histopathology. For clinical laboratory for anatomic pathology only, it provides services for any of the following but not limited to cytology and histopathology. For clinical laboratory for molecular pathology only, it provides services for genetics, immunohematopathology, and infectious disease. But for COVID-19 testing laboratories, it shall be covered by another order. Now let's go to procedural guidelines. For permit to construct, a completely filled out application form for DOH PTC, and this is downloadable at DOH website, whether manual or online. It shall be submitted to the DOH regulatory offices as specified in Section 5B of this order. A DOH PTC shall be required for construction of new CL and for renovation or expansion of existing CL, including change in ownership and transfer of location. The application shall be processed in accordance with the procedural guidelines set forth in AO number 2016-0042, also known as Guidelines in the Application for Department of Health Permit to Construct. For the license to operate, any person, firm, or corporation desiring to establish, operate, and maintain CL shall submit an accomplished application form to HFSRB CSD-RLED in accordance with the current DOH guidelines, whether manual or through the online licensing and regulatory system once it is fully functional. A complete application for DOH LTO of CL shall consist of the following: completely filled out application form 1 and its attachments are downloadable at DOH website. Notarized acknowledgement, and any of the following proof of ownership and name of health facility, that is DTI, SEC, CDA registration, including articles of incorporation or cooperation and bylaws, enabling act or LGU resolutions for government health facility. There should be also a complete self-assessment tool and the health facility geographic form. Copy of official receipt payment, certificate from NRL SACL for RIBDA confirmatory if applicable. Likewise, certificate from Newborn Screening Reference Center if applicable. Upon receipt of the complete application forms, the HFSRB CSD-RLED representative, in accordance with the current DOH guidelines, reviews the application and conducts an on-site assessment of the laboratory to determine full compliance with the standards and technical requirements. If upon assessment, the laboratory is not fully compliant with the licensing requirements, the HFSRB CSD-RLED, in accordance with the current DOH guidelines, shall provide a written report outlining the laboratory's deficiencies. The laboratory must comply with the deficiencies within 30 days, otherwise the application shall automatically be denied. The DOH LTO, whether initial or renewal, shall only be issued after the HFSRB CSD-RLED, in accordance with the current DOH guidelines, has determined that the laboratory is fully compliant. Submitted complete applications that are not processed within 20 days by the HFSRB CSD-RLED, in accordance with the current DOH guidelines, due to force majeure, shall automatically be granted the LTO and a post-licensing visit shall be scheduled. Only DOH licensed CL identified by the program and has already secured a certificate of certified RIBDA confirmatory laboratory from the NRL, SACL, or its designated regional counterpart shall be allowed to apply for a licensed confirmatory clinical laboratory. A DOH licensed hospital-based tertiary CL, already certified by the NSRC, may apply as a G6PD deficiency confirmatory laboratory to HFSRB. For institution-based CL, the one-stop shop OSS licensing system, pursuant to Administrative Order Number 2018-0016, dated June 4, 2018, revised guidelines in the implementation of the one-stop shop licensing system. The DOH LTO is non-transferable, and a new application for DOH LTO shall be required in case of change of ownership or transfer application. The HFSRB CSD-RLED, in accordance with the current DOH guidelines, shall be notified in writing of any change in management, name, ownership, or headship, or laboratory personnel. Failure to notify of any substantial change in the condition of the laboratory, that is, changes in the physical plant, equipment, or personnel in writing within 15 days may be a basis for the suspension or revocation of the DOH-LTO. Different branches or branches of a CL, even if owned by the same entity, shall secure separate DOH-LTO. Application for DOH-LTO shall be in compliance with AO number 2019-0004 dated April 30, 2019, guidelines on the annual cut-off dates for receipt of complete applications for regulatory authorizations issued by the Department of Health. The DOH-LTO shall be placed in an area that can be readily seen by the public at all times. For the certificate of registration, COR is required for research and teaching laboratories. Applicants shall submit an accomplished registration form, again downloadable at the DOH website, together with the necessary attachments to SFSRB, which includes Annex for services. The applicant shall be required to pay a non-refundable application fee before submission of the requirements as part of complete application. The SFSRB shall evaluate and accept applications based on the due execution of forms and completeness of attachment. For the validity, the DOH-LTO is valid for 1 year. COR for CL that is operated and maintained exclusively for research and teaching purposes shall be required to register with the DOH-SFSRB every 3 years. For the fees, all fees shall follow the prescribed fees by the DOH. All fees or checks shall be paid to the order of DOH Central Office or the CHD cashier, whichever is applicable in person, through postal money order or online payments approved by the DOH. For monitoring, authorized representatives from the SFSRB or CHD Ireland, in accordance with the current DOH guidelines, may conduct and announce on-site visits of licensed CL and registered research and teaching laboratories to monitor and document the continuous compliance of the CL to the set standards. If upon monitoring visit, the CL is found to be violating any of the rules and regulations stated herein relative to its operation, the SFSRB CHD Ireland, in accordance with the current DOH guidelines, may immediately impose preventive suspension. CL that are operated and maintained exclusively for research and teaching purposes shall not issue official results for diagnostic purposes. They may be monitored to ensure that they are not operating beyond allowed capabilities. And now, for violation, sanctions, and appeal. A clinical laboratory shall be sanctioned and penalized by the SFSRB or CHD Director upon violation of any of these guidelines and its related issuances and laws, or upon committal, commission, or omission of prohibited acts, Annex C, by the persons owning or operating the CL and or the persons under their authority. For non-institution-based CL that are not under the OSOS, the following are the penalties and sanctions that shall be imposed for the commission of any of the violations in this order and other relevant issuances. For the first offense, stern warning. For the second offense, they can pay 30,000 pesos. For the third offense, they will pay 50,000 pesos. For the fourth offense, revocation of DOH-LTO. For CL that are part of hospitals and other facilities that are subject to comply with the OSS licensure system, AO number 2007-0022 dated June 6, 2007, violations under the one-stop shop licensure system for hospitals, sanctions shall be governed by the aforementioned order. Any person who operates a CL without securing the necessary DOH-PTC and corresponding DOH-LTO shall be issued a cease and desist order and shall pay the administrative penalty of 50,000 pesos. Section 4 of Republic Act No. 4688 shall still be imposable aside from the administrative penalty provided in this order. In case of complaints, the CL upon receipt of such by HFSRB CHD Ireland shall be given due process wherein an investigation shall be conducted and the appropriate sanctions for its violations. A 60-day preventive suspension may be given to the CL during the investigation depending on the seriousness of the violation. Any CL or any of its personnel not amenable with the decision of the SFSRB or CHD Ireland may, within 10 days after the receipt of notice of decision, file a notice of appeal to the head of the health regulation team. All pertinent documents and records of the appellant shall then be elevated by HFSRB or CHD Ireland to the HRT. The decision of the head of the HRT, if is still contested, may be brought on a final appeal to the Secretary of Health, whose decision shall be final and executory. CL with revoked licenses can only reapply after 1 year from the date of LTO revocation. Any person authorized or licensed to conduct clinical laboratory tests who issues false or fraudulent laboratory test results knowingly, willfully, or through gross negligence shall not be allowed to own, manage, operate, or be an analyst upon any DOH licensed CL. For transitory provisions, all existing licensed CL shall be given 3 years to comply with the physical plant requirements from the date of effectivity of this order. All existing licensed CL shall be given 2 years to fully offer the additional services for each category with corresponding personnel and equipment from the date of effectivity of this order. For new CL, this order shall be immediately applicable. For CL currently headed by anatomic pathologist with an associate clinical pathologist or clinical pathologist heading tertiary CL with anatomic pathology services headships shall be retained until his or her eventual retirement, resignation, or replacement. Thereafter, all CL shall be headed by a pathologist certified in clinical pathology by the Board of Pathology of the Philippine Society of Pathologists, except for tertiary CL with anatomic pathology service, which shall be headed by a pathologist certified in both anatomic and clinical pathology. Repealing clause. These rules and regulations shall rescind Administrative Order Number 2007-0027, Revised Rules and Regulations Governing the Licensure and Regulation of Clinical Laboratories in the Philippines. All administrative orders and previous issuances inconsistent thereof. Separability. In the event that any provision or part of this order be declared unauthorized or rendered invalid by any court of law or competent authority, those provisions not affected by such declaration shall remain valid and effective. Effectivity. This order shall take effect 15 days following its publication in a newspaper of general circulation and upon filing 3 copies to the University of the Philippines Law Center. The administrative order take effect last July 22, 2021. And now let's go to licensing standards for clinical laboratory. For the physical plant, every clinical laboratory shall have an adequate space for its operation to safely, effectively, and efficiently provide services to clients. The CL shall conform to all applicable local and national regulations for the construction, renovation, maintenance, and repair of CL. The laboratory shall conform to the required space for the conduct of its activities. Personnel, fixtures, equipment, sink, and others shall also be considered. Minimum area requirements for each are listed in Annex D. There shall be well-ventilated, lighted, clean, safe, and functional areas based on the services provided. There shall be a program of proper maintenance and monitoring of physical plant and facilities. There shall be policy guidelines on laboratory biosafety and biosecurity. There shall be an area for confirmatory testing for RIBDA and G6PD deficiency, which may be a section, unit, or division integrated in a DS license CL if applicable. For personnel, every CL shall have an adequate number of trained personnel depending on the workload to provide safe, effective, and efficient services to clients. For the head of the laboratory shall be a competent and experienced professional with a specialized skill set related to and proportionate to the laboratory category to ensure that the laboratory runs efficiently. The head of the laboratory shall oversee the operation of the CL and have administrative and technical supervision of the activities, including the mobile clinical laboratories, remote collection activities, and point-of-care testing if applicable. The head of the laboratory shall supervise the staff in accordance to the standards set by the Philippine Society of Pathologists. The head of the laboratory shall visit once a month and at least twice a year, or a supervisory calls and or video conferencing, or at least once a week physician's visit. For hospital-based DOS license CL, it shall be once a week physical visit. Its visits shall have to be well documented. For geographical isolated and disadvantaged areas, or the GIDAs, with no clinical pathologists as certified by the Philippine Society of Pathologists, board-certified anatomic pathologists or physicians with complete training in clinical laboratory medicine, quality assurance, and laboratory management may head one primary DOS license CL. And now, for the registered medical technologies, there shall be an adequate number of full-time RNTs to conduct the laboratory procedures, including those assigned in MCL. The number of staff shall depend on the workload and the services being provided. There shall be staff development and continuing education program at all levels of organization to upgrade the knowledge, attitude, and skills of staff. There shall be a designated biosafety and biosecurity officer in charge primarily of the risk assessment of the DS license CL. For the support staff, there shall be an adequate number of support staff, such as but not limited to laboratory technician, laboratory aid, encoders, and receptionists when applicable. For POCT coordinator, a senior staff from the CL shall be designated as a POCT coordinator who shall have the following functions: recommends procedures that will ensure the quality of results of POCT in consultation with the pathologist, ensure that POCT machines or device and kits are properly maintained, supervises the operators of POCT device or machine, ensures that the operators have appropriate trainings and checks the competency of the operators regularly, ensures that quality control is implemented, and reviews POCT QC results periodically depending on the number of tests. For POCT operator if applicable, the designated operator of the POCT device or machine and testing kits shall have the following functions: ensures accurate results of POCT, ensure that POCT machines or device and kits are properly maintained and stored, run the test on quality control at least once each day or as recommended by the manufacturer. Initially, implements quality assurance program or contact the manufacturer's application specialist for assistance when a POCT machine or device is not properly functioning or the control sample is in out of control range. reports to the supervising CL any untoward incidents or problems concerning POCT. For the MCL personnel, it shall has its own set of personnel, which includes the following but not limited to: registered medical technologies. The number will depend on the anticipated workload. Supporting staff such as not limited to driver and laboratory technician. For the equipment, instruments, reagents, glasswares, and supplies. Every CL shall have an adequate equipment, instrument, reagents, glassware, and support, which are all in good working condition and sufficient for the operations. There shall be available an operational equipment or machines, devices to provide the laboratory examinations that the laboratory is licensed for. There shall be a calibration, preventive maintenance, and repair program for every equipment, machines, instruments, devices in the DOA's licensed CL. There shall be a contingency plan in case of equipment, machines, devices, breakdown, and malfunction. There shall be adequate available reagents, glasswares, and supplies for the laboratory examinations. There shall be an inventory control of the reagents, glasswares, and supplies. The reagents, glasswares, and supplies shall be properly stored under the required conditions. The machines or devices, reagents, and test kits that are used in the CL and MCL, as well as POCT, shall be approved by the Philippine Food and Drug Administration and validated by the proper government institutions, example the NRL. The MCL shall have its own set of functional and operational equipment, as well as its own set of supplies. For service delivery, the services provided by the CL shall ensure quality and safety to clients, to its and to the general public. All CL shall ensure that the service being delivered to patients must comply with the standards and other related relevant issuances. For mobile clinical laboratory, the collection site or area for MCL shall be located within the same region at a maximum of 100 km radius from the address of the DOA's licensed CL. Aside from specimen collection for different tests within the service capability of the main CL, the MCL shall be allowed to perform the following on-site tests, which shall be declared in the LTO of the main CL. The examinations done are urinalysis, fecalysis, pregnancy tests or the lateral flow, basic serologic tests using rapid test kits, dengue, screening of hepatitis B, RPR or syphilis test, and HIV. Specimen collected for other tests not mentioned above Section 5B2 should be properly handled and transported. Serum blood samples for primary tests must be separated within 4 hours from the time of collection. Information management. Every CL shall maintain a system of communication, recording, reporting, and releasing of results. For the administrative policies and procedures, the CL shall have written policies and procedures for the provision of laboratory services, the operation and maintenance of CL, which includes satellite laboratories, MCL, and POCT, and shall include the accountabilities of every personnel working in the laboratory. There shall be documented technical procedures for services provided in each section of the laboratory, including MCL and POCT, which will ensure the quality of laboratory results. There shall be a risk assessment for every section in the clinical laboratory. Communication and records management. The CL shall maintain and ensure the confidentiality of all records. There shall be producers for the receipt and performance of routine and stat requests for laboratory examinations. There shall be procedures for the reporting of results of routine and stat laboratory examination, including critical values that would impact on patient care. All results shall be released in accordance with DOC guidelines. All laboratory reports on biopsy examination specimens shall bear the name, PRC registration number, and original separate of the registered medical technologies who performed the laboratory examinations and the pathologists who shall be accountable for the reliability of the results. There shall be a policy guideline on the use of digital signature. The use of digital signature for laboratory results shall be permitted only if properly authenticated by the Department of Information and Communication, Philippine National Public Key Infrastructure. The use of digital signature shall also be in accordance with the provisions of the e-commerce law. There shall be procedures for the reporting of workload, quality control, work schedule, and assignments. There shall be procedures for the reporting and analysis of incidents, adverse events, and in handling complaints. The retention of laboratory documents, records, slides, and specimens shall be in accordance to the standards promulgated by the DOAs or by competent authorities for such purposes. The reporting hours of the CL shall be known to its clients. The CL which supervises the POCT shall have a master list of the following, but not limited to: name and designation of operators, POCT machines, instruments, and kits. For quality improvement, every CL shall establish and maintain a system for continuous quality improvement activities. There shall be an internal quality assurance program, which shall include an internal quality program for technical procedures, internal quality assurance program for inputs, processes, and outputs, continuous quality improvement program covering all aspects of laboratory performance. The CL shall participate in external quality assessment program or the ECAP that may be administered by a designated NRL or other local and international ECAP approved by the DOH. A periodic assessment shall be conducted by representatives from the top management, clinical laboratory, clinical departments, and nursing service to evaluate the policy of the CL on POCT. For the referral of laboratory examinations, every CL shall ensure the quality of services provided through an agreement or its equivalent to a DOS licensed CL performing the laboratory services needed. The referral laboratory must be a DOS licensed CL. They shall have a memorandum of agreement with the referring CL and shall be responsible for the collection, transport, and processing of specimens and releasing of results. A separate MOA is required when reported tests which are not within the service capability of the CL unless the referral is part of the contingency plan. A MOA prescribing the accountabilities of each party shall be secured when laboratory examinations are referred to and provided by another DOS licensed CL. Referral of examinations to other DOS licensed CL are only permitted in the following circumstances. If the laboratory test to be sent out is not part of the service capability expected for the particular category of the referring laboratory, and if referral of laboratory tests is part of the contingency plan in cases of equipment breakdown of the referring CL. This shall be for a certain limited period of time only, which shall not last for more than 3 months. This shall be properly documented. For the environmental management, every CL shall ensure that the environment is safe for its patients and staff, including the general public. There shall be a program of proper maintenance and monitoring of physical facilities. There shall be procedures for proper disposal of infectious waste and toxic and hazardous substances in accordance with RA 6969 or the Toxic Substances and Hazardous and Nuclear Waste Control Act of 1990 and other related policy guidelines and or issuances. There shall be a no smoking policy. There shall be a contingency plan in case of accident and emergencies. There shall be a policy for biosafety and biosecurity, and there shall be a policy guidelines on infection prevention and control.